Mr. President, sir, members of the Senate debated late into the night because they wanted to make this enterprise even better. Your Excellency, as a professional of medicine, I want to confirm that you are truly going to be remembered in this country for what you have done, because it is lack of primary health attention to the concerns of patients that eventually leads to the loss of unnecessary lives. Mr. President, the innovation of the digital health bill is going to save millions upon millions of Kenyans, because many mothers, some of them, have no idea what the doctor said 6 months ago when the child presented to them. And when they have to restart the story, they lose out on very important information. But with the digital innovation, this will no longer be necessary. And remembering that some of our mothers do not have the standard of education required, and Mr. President, remembering that some of the mothers also live with disabilities, including the disability of inability to talk, the disability of inability to hear, Mr. President, this indeed is the time for this legislation. I thank you and I congratulate you. Uriomno.
To our Council of Governors, we want to say we are truly grateful for your partnership. I did commit to our county governments that this administration will not undermine our county governments, and that this administration supports fully county governments in the discharge of their responsibility on health and their mandate on health, and that we are going to work together to make sure that counties succeed, because when counties succeed, Kenya succeeds. And I want to say we congratulate you for your input, as always. And the encouragement that we've gone through this together. I want to give you my assurance that we will not let counties down, especially on the subject of health, because by letting counties down, we will be letting Kenya down, and that we will not do. As you have said correctly, there will be a follow-through with regulations that will underpin some of the specific items of these pieces of legislation. A lot of work has gone into the development of regulations. We will now take them through the processes, making sure that the public have a say, making sure that all the other stakeholders are brought on board, so that we can have the chance to implement universal health coverage this time round and succeed. It is the one thing that we must get right, because Kenyans collectively aspired for quality, affordable, and accessible healthcare system. Not for a short time. We've been here for a very long time. Speaker Wetangula will remember in 2012 with President Kibaki, we tried, but we didn't quite get it where we wanted. We tried again in 2017, 2018, but the trials that went in Nyeri, Isiolo, Kisumu, and one more county, there were 4 counties, and Machakos. You remember they failed. The whole thing collapsed. And it was because it needed some thorough thinking. And that is why this time round, we decided to create a farmer-based.
Your Excellency, you will recall that during the campaigns last year and in the run-up to the campaigns, you did promise the people of Kenya radical changes in our healthcare architecture of the country to actualize the universal health coverage dream that has faltered in the governance of our country over the last close to 15 or so years. Your Excellency, your assent to these 4 bills today makes that dream become a reality in the very near future. And we look forward to the implementation of these bills by the Ministry of Health and all the stakeholders that will be involved in the implementation of the 4 bills. The radical changes in our healthcare architecture will see not just the realization of universal healthcare coverage for millions of our people, but will bring to an end the rendering to destitution of millions or hundreds of thousands of families across the length and breadth of the country, families that have been rendered homeless. Others, Your Excellency, have lost many of their assets on account of healthcare bills. The Social Health Insurance Fund Bill, Your Excellency, will in a big way transform the social health insurance subsector of our country and assure Kenyans that they shall no longer have to lose their homes, they shall no longer be rendered homeless or become destitute in their own country on account of healthcare bills that they have incurred in hospitals. Your Excellency, the Digital Health Bill leverages in a great way on how we leverage on technology to improve the efficient and effective provision of healthcare services from the far-flung corners of our country to the level 5, level 6 referral hospitals in our country. It will be possible now, Your Excellency, in due time for Kenyans to be able to have a CT scan in Elwak and have a medical consultant in Kenyatta National Hospital or Nairobi Hospital review that CT scan and be able to advise the healthcare professional back at a health center in Elwak on how to treat their patients. It is this revolutionary interventions, Your Excellency, through a very participative process that began with the Ministry of Health, and I must commend the Ministry of Health for the very detailed and participatory approach they began almost a year ago when your administration came in power, culminating to the assent of these 4 bills today. That participatory approach, Your Excellency, culminated in what has also now anchored a new way of working between the 2 houses of Parliament, and I'm glad to inform Your Excellency that the bicameral Parliament has worked very well together, both houses, the Senate and the National Assembly. And we saw the passage of these bills in both houses. The bills that originated from the National Assembly were passed in the Senate without a single amendment, and those that emanated from the Senate were passed in the National Assembly without a single amendment through a process where the 2 houses, both committees of health in the 2 houses were able to consult ahead of the passage of the bills and agreed on the nature and manner of amendments that they wanted passed, and they were done in each house. And Your Excellency, I believe this also